Hello everyone. Today we will come to discuss on the topic ointment. Ointment is coming from the chapter Introduction of the Dosage Form. In the previous class, we will discuss about the classification of the dosage form. Here, we have discussed the types of the dosage form like solid dosage form, liquid dosage form, and semi-solid dosage form. And here, the ointment is coming from the semi-solid dosage form of medicament. Today we will discuss about what is ointment, types of the ointment, what are their advantages and disadvantages of ointment, application of ointment and ointment base. And also we will discuss briefly about ointment base. Here we discuss about what are their basic ideal properties of the ointment, and classification of the ointment base, what is ointment base, etc. First, coming to the basic introduction of the ointment. What is ointment? Ointment is a semi-solid preparation which are meant for application to the skin or mucous membrane. In this preparation, the medicament are dissolved or suspended in a ointment base. Ointment base is served as a carrier for medicament in the preparation of the ointment. Here, discuss the basic definition, that is ointment is any greasy or oily semi-solid preparation which are usually medicated that can be applied externally to the skin in order to heal, soothe or protect it. It is a viscous semi-solid preparation and which are used topically on a variety of the body surface. That means this type of the preparation we are used in a variety of the body part. Next, classification of the ointment. Ointment are classified basically two types, unmedicated ointment and medicated ointment. Unmedicated type of the ointment are not used for medical purpose. Unmedicated ointment do not contain any drug. They are used as a emollient and protectant purpose, as for example petroleum jelly. In daily basis, in our daily life, we are used as for example like Vaseline. Vaseline we are used for emollient purpose to the skin. Unmedicated ointment. These ointment contain drugs which show local or systemic effect. These are of several subtypes, as for example dermatological ointment, ophthalmic ointment, rectal ointment, vaginal ointment and nasal ointment. According to their use of the ointment, it should be classified. As for example, those ointment which are used for skin purpose, it is termed as a dermatological ointment. The ointment which are used for skin, it is termed as a ophthalmic ointment, and those which are used for rectal purpose known as rectal ointment, and for use of the vaginal purpose it is known as vaginal ointment, and those ointment which are used for the purpose of the nasal, it is known as nasal ointment. Dermatological ointment, these are applied topically on the external skin. The ointment is applied to the affected area as a thin layer and spread evenly using a gentle pressure with the help of fingertips. Dermatological ointment again classified according to their types of the skin. These are epidermic ointment, endodermic ointment and diadermic ointment. Epidermic ointment. The drug present in this type of the ointment exert their action on the epidermis of the skin, that means outer layer of the skin, as for example ketoconazole ointment. Endodermic ointment. The drug present in this type of the ointment exert their action on the deeper layer of the cutaneous tissue. That means this type of the ointment will show their action on the cutaneous tissue. And diadermic ointment, the drug present in this type of ointment entered into the deeper layer of the skin and finally in the systemic circulation, and they exert their effect onto the systemic circulation. Ophthalmic preparation, the ointment which are meant for use to the eye, it is known as the ophthalmic ointment. Ophthalmic preparation always should be sterile preparation. In this preparation, only anhydrous base are used in their preparation. The ointment is applied as a narrow band of approximately 0.25 to 0.5 inch. Rectal ointment. These are ointment to be applied to the perianal or within the anal canal. These base are use combination of the PEG 300 and PEG 3350, cetyl alcohol and cetyl ester, wax, liquid paraffin, etc. Vaginal ointment. These ointment are applied to the vulvovaginal area or inside the vagina. A vagina is more susceptible to the infection, and ointment should be free from microorganisms. That means this type of the preparation also need a sterile. To maintain the sterility of the preparation. Nasal ointment. These are used in the topical treatment of nasal mucosa. Drug get absorbed into the general circulation through the rich blood supply of the nasal lining. Now, coming to the basic advantages of the ointment preparation. Handling of the ointment is very easy as compared to the liquid dosage form. Bulky amount of the handling of the bulky amount of the liquid doses will create many difficulty, but in case of the ointment it is very easy to handle. They are chemically more stable than the liquid dosage form. The stability of the semi-solid dosage form or ointment, it is more in comparison to the liquid dosage form. Number 3, they facilitate application of directly to the affected part and avoid the exposure of other part to the drug. That means in case of the ointment, the drug should directly apply to the affected area. But in case of the the solid dosage form or liquid dosage form, it is not possible to apply the drug directly on the affected area. Number 4, they are suitable for the patient who find it difficulty to take the drug by parenteral or other route. In the condition when the patient is not able to take the medicine through the parenteral or oral route, in those cases, this route of the administration, that means the ointment type of the formulation is very useful. They prolong the contact time between the drug and affected area. The bioavailability of the drug administered ointment is more since it prevents the passages through the lungs. If a drug is passages through the lung, sometimes the drug will show the first pass effect, then it will decreases their bioavailability. But in case of the ointment, the ointment have the facility to directly apply to the affected area. That means it will have a better bioavailability in comparison to the other dosage form. Disadvantages. They are bulkier than the solid dosage form. When the application of the exact quantity of the ointment to the affected area is required, it is difficult to ascertain the same. That means the measurement of the dosage form is quite difficult. Difficult in comparison to the other dosage form. They are less stable than the solid dosage form. Now, application of the ointment. Ointment are used topically for several purposes, as for example, as a protectant, antiseptic, emollient, etc. In case of the protective ointment, it serves to protect the skin against moisture, air, sun ray, and other external force, as for example, sunscreen. An antiseptic ointment has the property to protect the skin from the microbial contamination, because the antiseptic ointment have the property to kill or destroy the growth of the microorganism or bacteria. Ointment used for their emollient effect should be easy to apply, be non-greasy, and effectively penetrate the skin. Now moving to the ointment base. Ointment base is a carrier for medicament in the preparation of the ointment. Ointment base are mainly classified into 5 types. Number 1, oleogenous base, absorption base, water in oil emulsion base, oil in water emulsion base, and water soluble or water miscible base. Oleogenous base. These bases are fats, fixed oil, hydrocarbon, silicon, etc. They are anhydrous in their nature, greasy, and non-washable. It does not absorb the water. does not absorb the water from a film on the skin, so it increases the skin hydration by reducing the rate of loss of the surface water. In case of the infected skin, oleogenous base cannot be used because it is non-washable, and it is producing a film on the skin. As for example, white petroleum. This is a picture of the white petroleum. Absorption base. Oleogenous base plus water in oil type of the surfactant. It is anhydrous but hydrophilic in nature. They can absorb several times of their weight of water and to form a W/O type of the emulsion. These are also non-washable and not water soluble. As for example, hydrophilic petrolatum. O by W type of the emulsion ointment base. These bases are anhydrous, water soluble, and it absorbs the water and it is water washable. They are either carboxylase, polyethylene glycol, or hydrated gums like bentonite, gelatin, cellulose derivative, etc. As for example, PEG ointment. Water miscible ointment base. These bases are anhydrous, water soluble, it absorbs the water. As for example, PEG ointment. For choosing the ointment base, they have some property like it have a low sensitization index, pharmaceutical allegiance. They are non-irritating property, non-dehydrating, natural in reaction. It should be compatible with the other common medicaments which are used in the preparation of the ointment, and it have the property to release the medicament efficiently at the site of the application. It should be washable and minimum number of the ingredient and easy of compounding. These are the references through which I have collected the data. Thank you.